Depression. Informational packets and/or forms will be located at the following website. I want to apologize for my pronunciation of the medical terms and prescriptions. I understand that sometimes they could be incorrect. Definition of depression. Depression, also known as major depressive disorder or clinical depression, is a serious mood disorder that significantly affects how you feel, think, and act. It is characterized by a persistent feeling of sadness and a loss of interest in activities that you once enjoyed. This condition can interfere with daily functioning, impacting work, school performance, personal relationships, and overall quality of life. To be diagnosed with depression, symptoms must be present for at least 2 weeks and must represent a change from previous functioning. These symptoms can vary in intensity and may include feelings of hopelessness, changes in appetite or sleep patterns, fatigue, difficulty concentrating, and thoughts of death or suicide. Depression is not just a temporary mood change. It can last for weeks, months, or even years if left untreated. It is a common mental disorder affecting millions of people worldwide. Signs and symptoms of depression. Depression manifests through a variety of emotional, cognitive, and physical symptoms. Persistent sadness. Individuals often experience a prolonged feeling of sadness or a low mood that lasts for most of the day, nearly every day. Loss of interest. A significant loss of interest or pleasure in activities that were once enjoyable, such as hobbies, socializing, or work, is a hallmark symptom of depression. Feelings of hopelessness. Many people with depression may feel hopeless or helpless, believing that their situation will never improve. Irritability and anger. Instead of sadness, some individuals, particular teens, may exhibit increased irritability, anger, or agitation. Changes in appetite or weight. Depression can lead to significant changes in appetite, resulting in weight loss or gain that is not related to dieting. Sleep disturbances. Individuals may experience insomnia or hypersomnia, sleeping too much, which can further exacerbate feelings of fatigue. Fatigue and low energy. A common symptom is a persistent lack of energy or fatigue, making even simple tasks feel overwhelming. Difficulty concentrating. Many people with depression report trouble focusing, making decisions, or remembering things. Physical symptoms. Depression can also manifest through physical symptoms such as unexplained aches and pains, headaches, or digestive issues. Suicidal thoughts. In severe cases, individuals may experience thoughts of death or suicide, which require immediate attention and intervention. Please note that not everyone with depression will experience all of these symptoms, and the severity may vary depending among individuals. If you or someone you know is experiencing these symptoms, seeking professional help is crucial for effective treatment and support. Things to do when depressed. When dealing with depression, it can be challenging to find motivation or joy in activities. However, engaging in certain actions can help alleviate some symptoms and improve your mood. Get outside. Spending time in nature or simply getting fresh air can simply boost your mood. Even a short walk in the sunlight can help lessen feelings of depression. Connect with others. Reach out to friends or family members. Social interaction, even if it is just a brief chat, can improve comfort and support. Engage in creative activities. Expressing yourself through art, writing, or music can help channel your feelings and provide a sense of accomplishment. Stay active. Physical activity, such as walking, jogging, or even doing household chores, can release endorphins and improve your mood. Exercise doesn't have to be intense, even light activities can be beneficial. Practice mindfulness or relaxation techniques. Activities like meditation, deep breathing exercises, or yoga can help calm your mind and reduce stress. Set small goals. Break tasks into manageable steps. Completing even small chores can provide a sense of achievement and help combat feelings of helplessness. Watch something funny. Laughter can be a great mood booster. Watching a comedy or funny videos can help lighten your mood. Limit negative impacts. Try to reduce exposure to negative news or social media, which can exacerbate feelings of depression. Help others. Engaging in acts of kindness, even small ones, can improve your mood and provides a sense of purpose. Stay hydrated and nourished. Drinking water and eating healthy foods can have a positive impact on your energy levels and overall well being. It's important to be gentle with yourself and recognize that it's okay to take things one step at a time. If feelings of depression persist, seek professional help. It's crucial for effective treatment and support. Types of depression. Major depressive disorder, persistent depression disorder, atypical depression, seasonal affective disorder, bipolar depression, psychotic depression, and postpartum depression. Major depressive disorder, MDD. Major depressive disorder, also known as clinical depression, is a serious mood disorder that significantly impacts daily life. It is characterized by a persistent feeling of sadness and a loss of interest in activities that were once enjoyable. This condition can interfere with various aspects of life, including work, relationships, and overall well being. Symptoms. To be diagnosed with MDD, an individual must experience a combination of the following symptoms for at least 2 weeks: depressed mood, a persistent feeling of sadness or emptiness; loss of interest, a marked decrease in interest or pleasure in most activities; feelings of worthlessness or guilt, excessive or inappropriate feelings of guilt; fatigue or loss of energy, a significant decrease in energy levels. Sleep disturbances, insomnia or hypersomnia, sleeping too much. Appetite changes, significant weight loss or gain, or changes in appetite. Poor concentration, difficulty making decisions or concentrating. Psychomotor agitation or retardation, observable restlessness or slowed movements. Suicidal thoughts, recurrent thoughts of death or suicide. Causes and risk factors. The exact cause of MDD is not fully understood, but it is believed to be a result from a combination of genetic, biological, environmental, and psychological factors. Stressful life events, such as the loss of a loved one, divorce, or serious illness, can trigger episodes of depression. Additionally, a family history of depression can increase the risk. Treatment options. Treatment for MDD typically involves a combination of psychotherapy and medication. Cognitive behavioral therapy, CBT, a type of psychotherapy that helps individuals identify and change negative thought patterns. Antidepressant medications. These can help balance chemicals in the brain that affect mood. However, their effectiveness may vary, and they are often most beneficial for those with severe depression. In some cases, hospitalization may be necessary, especially if there is a risk of self harm or severe self neglect. Major depressive disorder is a common but serious mental health condition that requires appropriate treatment and support. If you or anyone you know is experiencing symptoms of MDD, seeking professional help is crucial for effective management and recovery. Persistent depressive disorder, dysthymia. Persistent depressive disorder, PDD, formerly known as dysthymia, is a common form of depression characterized by a low level, long lasting depressed mood. Unlike major depressive disorder, which involves more serious symptoms that can come and go, PDD is marked by a consistent state of sadness or emptiness that persists for 2 years or more in adults and at least 1 year in children and adolescents. Symptoms. The symptoms of PDD are similar to those of major depression, but tend to be less severe. Chronic low mood, a depressed or irritable mood on most days. Loss of interest, reduced interest or pleasure in activities that were once enjoyable. Fatigue, persistent low energy and fatigue. Sleep disturbances, changes in sleep patterns such as insomnia or oversleeping. Appetite changes, significant changes in appetite leading to weight gain or loss. Poor concentration, difficulty making decisions or concentrating. Feelings of hopelessness, a pervasive sense of hopelessness or low self esteem. Individuals with PDD may feel that their depression is part of their character, leading them to believe that they cannot change or improve their situation. This may make it difficult for them to seek help or discuss their feelings with others. Causes and risk factors. The exact cause of PDD is not fully understood, but it is believed to result from a combination of biological, sociological, and environmental issues. Chronic stress, trauma, and family history of depression can increase the risk of developing this disorder. PDD is more common in women than in men, and it is often concurrent with other mental health conditions, such as anxiety disorder or major depressive disorder. Treatment options. Options for persistent depressive disorder typically involve a combination of psychotherapy and medication. Cognitive behavioral therapy, CBT. This therapy helps individuals identify and change negative thought patterns and behaviors. Antidepressant medications. These can help regulate mood and alleviate symptoms. Research indicates that antidepressants can be effective for PDD, similar to their effectiveness for major depression. Persistent depressive disorder is a long-term condition that can significantly impact an individual's quality of life. If you or someone you know is experiencing symptoms of PDD, seeking professional help is necessary for effective management and recovery. Early intervention can lead to better outcomes and improved well-being. Atypical depression. Atypical depression is a subtype of major depressive disorder characterized by specific symptoms that differentiate it from the other forms of depression. One of the defining features of atypical depression is that individuals may experience a temporary improvement in mood in response to positive events, which is not typical in other forms of depression. Symptoms. Mood reactivity. A noticeable improvement in mood when experiencing positive events, such as social gatherings or personal achievements. Increased appetite. Unlike typical depression, which often leads to a loss of appetite, atypical depression may cause overeating or weight gain. Hypersomnia. Individuals may experience excessive sleepiness or sleep for longer periods than usual, even if they feel rested. Rejection sensitivity. A heightened sensitivity to interpersonal rejection, leading to significant social or occupational impairment. Fatigue. Persistent feelings of fatigue or weakness, often described as a heavy sensation in the limbs. Causes and risk factors. The exact cause of atypical depression are not fully understood, but it is believed to involve a combination of genetic, biological, and environmental factors. Individuals with a history of anxiety disorder, bipolar disorder, or certain personality traits may be at higher risk for developing atypical depression. Stressful life environments and trauma can also contribute to its onset. Treatment options. Treatment for atypical depression typically includes a combination of psychotherapy and medication. CBT. This therapy helps individuals identify and change negative thought patterns and behaviors. Antidepressant medications. Atypical depression has shown a better response to minoxidil inhalers MAOIS, compared to tricyclic antidepressants, TCAS. Atypical depression is a common and treatable condition that can significantly impact an individual's quality of life. If you or someone you know is experiencing symptoms of atypical depression, seeking professional help is essential for effective management and recovery. Early intervention can lead to improved outcomes and a better quality of life. Seasonal affective disorder, SAD. Seasonal affective disorder, SAD, is a type of depression that occurs at specific times of the year, most commonly during the fall and winter months when daylight hours are shorter. Individuals with SAD typically experience symptoms that begin in the late fall and continue through the winter, improving with the arrival of spring and longer daytime hours. Symptoms. The symptoms of SAD can resemble those of major depressive disorder. Depressed mood, persistent feelings of sadness or hopelessness. Loss of interest, a decrease in interest or pleasure in activities once enjoyed. Fatigue, low energy levels, and increased sleepiness. Changes in appetite, often leading to weight gain due to increased cravings for carbohydrates. Difficulty concentrating, trouble focusing or making decisions. Social withdrawal, a tendency to isolate oneself from friends and family. Causes and risk factors. The exact cause of SAD is not fully understood, but it is believed to be linked to changes in sunlight exposure, which can affect the body's internal clock. Reduced sunlight may lead to altered melatonin production. Increased levels of melatonin, a hormone that regulates sleep, can contribute to feelings of lethargy and depression. Lower serotonin levels. Reduced sunlight exposure may lead to decreased serotonin, a neurotransmitter that affects mood, appetite, and sleep. Risk factors for developing SAD. Geographic location. Individuals living in northern latitudes with longer winters and shorter days are at a higher risk. Family history. A family history of depression or other mood disorders can increase susceptibility. Age and gender. SAD is more common in women and often begins in young adulthood. Treatment options. Treatment for seasonal affective disorder typically involves a combination of approaches. Light therapy. Exposure to bright light using a light therapy box can help alleviate symptoms by mimicking natural sunlight. Psychotherapy. CBT can be effective in addressing negative thought patterns associated with SAD. Medications. Antidepressants may be prescribed to help manage symptoms, particularly if they are severe or persistent. Seasonal affective disorder is a recognized and treatable condition that can significantly impact an individual's quality of life. If you or someone you know is experiencing symptoms of SAD, it is important to seek professional help for effective treatment and support. Early intervention can lead to better outcomes and improve well-being during the affected seasons. Bipolar depression. Bipolar depression refers to the depressive episodes associated with individuals with bipolar disorder, a mental health condition characterized by extreme mood swings that include both manic and depressive episodes. While the manic episodes can be marked by elevated mood and increased energy, the depressive episodes can be particularly distressing and may last for weeks or even months. Symptoms of bipolar depression. The symptoms of bipolar depression can be similar to those of major depression and might include persistent sadness, a deep sense of hopelessness or despair, loss of interest, a marked decrease in interest or pleasure in most activities, fatigue, significant fatigue or loss of energy, making even simple tasks feel overwhelming, sleep disturbances, changes in sleep patterns such as insomnia or sleeping too much, appetite changes, significant weight loss or gain due to changes in appetite, difficulty concentrating, troubles focusing, making decisions, or remembering things, suicidal thoughts, increased risk of suicidal ideation or behavior, particularly during depressive episodes, causes and risk factors. The exact cause of bipolar depression are not fully understood, but several factors may contribute. Genetics. A family history of bipolar disorder or other mood disorders increases the risk. Environmental factors. Stressful life events, trauma, and substance abuse can trigger episodes. Brain chemistry. Imbalances in neurotransmitters may play a role in mood regulation. Treatment options. Treating bipolar depression typically involves a combination of medication and psychotherapy. Mood stabilizers. Medications such as lithium are often used to help stabilize mood and prevent both manic and depressive episodes. Antidepressants. These may be prescribed, but they are used cautiously due to the risk of triggering manic episodes. Psychotherapy, CBT, and other therapeutic approaches can help individuals manage their symptoms and develop coping strategies. More research is needed. Recent studies have also indicated that certain modern antipsychotics may be effective in treating bipolar depression, although more research is needed to establish their long term efficiency. Bipolar depression is a significant aspect of bipolar disorder that can severely impact an individual's quality of life. If you or someone you know is experiencing symptoms of bipolar depression, seeking professional help is crucial for effective management and support. Early intervention can lead to better outcomes and improve well being. Psychotic disorder. Psychotic disorder, also known as depressive psychosis, is a severe form of major depressive disorder characterized by the presence of psychotic symptoms alongside depressive symptoms. This condition can significantly impair an individual's ability to function and requires immediate medical attention. Symptoms. Individuals with psychotic depression experience symptoms of major depression, persistent sadness, a deep sense of hopelessness or despair, loss of interest, a marked decrease in interest or pleasure in most activities, fatigue, significant fatigue or loss of energy, sleep disturbances, changes in sleep patterns such as insomnia or excessive sleeping, appetite changes, significant weight loss or gain due to changes in appetite. In addition to these depressive symptoms, psychotic depression also includes hallucinations. These may involve hearing voices that criticize or demean the individual, such as telling them they are worthless or have committed a crime. Delusions, false beliefs that are often consistent with the individual's depressed mood, such as feelings of worthlessness or guilt. For example, a person may believe that they are responsible for a tragedy or that they are being punished for perceived failures. Causes and risk factors. The exact cause of psychotic depression is not fully understood, but several factors may contribute. Genetics. A family history of depression or psychotic disorder increases the risk. Environmental factors. Stressful life events, trauma, and substance abuse can trigger episodes. Brain chemistry. Imbalances in neurotransmitters may play a role in mood regulation and psychotic symptoms. Treatment options. Treatment for psychotic disorder typically involves a combination of medication and psychotherapy. Antidepressant medications. These are often prescribed to help alleviate depressive symptoms. Antipsychotic medications. These may be used to address psychotic symptoms, primarily if they are severe. Psychotherapy. TBT and other therapeutic approaches can help individuals manage their symptoms and develop coping strategies. In some cases, hospitalization may be necessary to ensure the safety of the individual, especially if there are persistent thoughts of self harm or suicide. Psychotic depression is a serious mental health condition that requires prompt and effective treatment. If you or someone you know is experiencing symptoms of psychotic depression, seeking professional help is crucial for effective management and support. Early intervention can lead to better outcomes and improve quality of life. Postpartum depression. Postpartum depression is a serious mental health condition that can affect women after childbirth. It is characterized by prolonged feelings of sadness, anxiety, and fatigue that can interfere with a mother's ability to care for herself and her baby. Unlike the baby blues, they typically resolve within a few days to weeks. Postpartum depression can last for months and requires treatment. Symptoms. The symptoms of postpartum depression can vary, but often include persistent sadness, a deep sense of helplessness or despair that does not go away, loss of interest, a marked decrease in interest or pleasure in activities including caring for the baby, fatigue, extreme tiredness that does not improve with rest, sleep disruptions, insomnia or sleeping too much, often accompanied by feelings of restlessness, appetite changes, significant weight loss or gain due to changes in appetite, difficulty bonding, feeling disconnected from the baby or not feeling like a mother, suicidal thoughts. In severe cases, thoughts of self harm or harming the baby may occur. Causes and risk factors. The exact cause of postpartum depression is not fully understood, but several factors may contribute. Hormonal changes, fluctuations in hormones after childbirth can affect mood. Genetics, a family history of depression or other mood disorders increase the risk. Stressful life events, factors such as lack of support, financial stress, or a difficult pregnancy can heighten the risk of developing PPD. Previous mental health issues. Women with a history of depression or anxiety are at a higher risk for postpartum depression. Treatment options. Treatment for postpartum depression typically involves a combination of medication and psychotherapy. Antidepressants. These can help alleviate depressive symptoms and are often safe for breastfeeding mothers. Psychotherapy. Cognitive behavioral therapy and other therapeutic approaches can help individuals manage their symptoms and develop coping strategies. Support groups. Connecting with other mothers experiencing similar challenges can provide emotional support and reduce feelings of isolation. Postpartum depression is a significant mental health condition that can impact both the mother and her relationship with her baby. If you or someone you know is experiencing symptoms of postpartum depression, it is crucial to seek professional help. Early intervention can lead to better outcomes and improve mental well being for both the mother and the child. Understanding the different types of depression is crucial for effective treatment and management. If you or someone you know is experiencing symptoms of depression, seeking professional help is essential. Things you can do to help with depression. Regular routines during depression. Establishing and maintaining regular routines can be a powerful tool for managing depression. When experiencing depressive symptoms, individuals often struggle with motivation and energy, making it challenging to engage in daily activities. However, having a structured routine can provide a sense of stability and predictability, which can help alleviate some of the emotional burdens associated with depression. Benefits of a routine. A consistent routine minimizes the number of decisions you need to make each day. This can help reduce stress and anxiety, as having fewer choices can make life feel more manageable. Improve sleep quality. Establishing a regular bedtime schedule is crucial. Going to bed and waking up at the same time each day can enhance sleep quality, which is often disrupted during depressive episodes. A calming bedtime routine, such as dimming lights and turning off screens, can also promote better sleep. Encouraging healthy habits. Routines can help incorporate healthy behaviors such as regular exercise and nutritious meals. Physical activity is known to improve mood and reduce symptoms of depression, while a balanced diet can provide the necessary nutrients to support mental health. Provide structure. Having a daily structure can help individuals feel more in control of their lives. This is particularly important during times of emotional distress, as routines can serve as anchors and provide a sense of normalcy. Facilitates mindfulness. Incorporating mindfulness practices into your routine, such as meditation or journaling, can help improve mental regulation and reduce feelings of anxiety and sadness. Tips for creating a routine. Start small. Begin with simple tasks that are easy to accomplish, such as making your bed or taking a short walk. Gradually build up to more complex activities as you feel more capable. Be flexible. While routines are beneficial, it's important to remain flexible. Allow yourself to adjust your routine as needed, especially on days when your symptoms are more severe. Include enjoyable activities. Make sure to incorporate activities that you enjoy or that bring you a sense of accomplishment. This could include hobbies, spending time with loved ones, or engaging in creative pursuits. Seek support. If you're struggling to maintain a routine, consider reaching out to friends, family, or mental health professionals for support. They can help encourage you and hold you accountable. Regular routines can play a significant role in managing depression by providing structure, reducing stress, and promoting healthy habits. While it may be challenging to establish and stick to a routine during depressive episodes, even small steps can help to improve in mood and overall well being. Exercise during depression. Exercise is a powerful tool that can significantly benefit individuals experiencing depression. Engaging in physical activity has been shown to improve mood, increase energy levels, and provide a sense of accomplishment. While it can be challenging to motivate oneself to exercise during depressive episodes, incorporating physical activity into your routine can lead to positive changes in mental health. Eating healthy during depression. Healthy eating plays a crucial role in managing depression and can significantly impact overall mental health. While there is no specific diet that cures depression, research suggests that certain dietary choices can help alleviate symptoms and improve mood. Self care is an essential component of managing depression and improving overall mental health. By incorporating self-care strategies into your daily routine, you can foster resilience, enhance emotional well-being, and promote healing. Remember, taking small steps towards self-care can lead to significant positive changes over time. Sleep during depression. Sleep is a critical component of overall health, and its relationship with depression is complex. Many individuals with depression experience sleep disturbances, which can exacerbate symptoms and create a cycle of poor mental health. Understanding the impact of sleep on depression and implementing strategies to improve sleep quality can significantly enhance well being. Therapies for depression without medication. If you're looking for ways to manage depression without resorting to medication, there are several effective therapies and practices you can consider. Psychotherapy. Cognitive behavioral therapy, CBT. This is one of the most popular and effective forms of psychotherapy for depression. CBT focuses on identifying and changing negative thought patterns and behaviors, helping individuals develop healthier coping skills. Interpersonal therapy, IPT. This therapy addresses interpersonal issues and aims to improve relationships and social functioning, which can alleviate depressive symptoms. Mindfulness and relaxation techniques. Mindfulness meditation. Practicing mindfulness can help you stay present and reduce stress, which may improve mood and overall mental health. Structured mindfulness based therapies have been developed specifically to treat mental health issues. Yoga and meditation. Both practices combine physical activity with stress reduction techniques, which can be beneficial for managing depression. Physical activity. Regular exercise. Engaging in moderate aerobic exercise, such as walking or cycling, for about 30 minutes 3 times a week, have been shown to be as effective as some medications in relieving symptoms of depression. Exercise releases endorphins, which can enhance mood. Complementary therapies, yoga, and acupuncture. Some studies suggest that yoga may help alleviate symptoms of depression, although the evidence is not conclusive. Acupuncture is another alternative treatment that some find beneficial. Massage therapy. This can help reduce stress and promote relaxation, which may improve mood. Herbal remedies. St. John's wort. This herbal supplement is commonly used in Europe for treating depression. However, its effectiveness is debated among American physicians and can interact with other medications, so it's important to consult a healthcare provider before use. Lifestyle changes. Diet and nutrition. A balanced diet rich in omega-3 fatty acids, whole grains, and plenty of fruits and vegetables can support mental health. Some studies suggest that certain dietary changes may help reduce depressive symptoms. Support groups. Peer support. Engaging with support groups can provide a sense of community and understanding, which can be incredibly beneficial for those dealing with depression. These therapies can be effective in their own or conjunction with other treatments. It's essential to consult with a healthcare professional to determine the best approach for your individual needs. Remember, depression is a serious condition, and seeking help is a vital step towards recovery. Medication during depression. Medication is a common and effective treatment option for individuals experiencing depression. While it does not cure depression, it can simply alleviate symptoms and improve quality of life. We will talk more about medication in a different video. Considerations for medication. Consultation with a healthcare provider. It's essential to work closely with the healthcare provider to determine the most appropriate medication based on individual symptoms, medical history, and potential side effects. Trial and error. Finding the right antidepressants can take time and may involve trying different medications to see which works best for you. It's important to be patient and communicate openly with your doctor about your experiences. Side effects. All medications can have some side effects, which may vary from person to person. Common side effects of antidepressants can include nausea, weight gain, sexual dysfunction, and insomnia. Discussing these with your healthcare provider can help manage them effectively. Duration of treatment. Antidepressants are often prescribed for several months, even after symptoms improve, to prevent relapse. The American Psychiatric Association recommends continuing medication for at least 4 to 5 months after recovery from a depressive episode. Combination with therapy. Medication is often most effective when combined with psychotherapy. This integrated approach can address both symptoms and underlying causes of depression. Medication can be a vital part of managing depression, helping to alleviate symptoms and improve overall functioning. By working closely with healthcare providers and considering various treatment options, individuals can find the right approach to support their mental health. My thoughts. First, I am not a doctor. During the holiday season, depression is recognized and you may feel the need to deal with it. Look for self-care and therapies you can provide yourself. Find a doctor for a diagnosis. Then look into counseling and or medication. If you are feeling suicidal, you need help immediately. Please go to your nearest emergency room or call, text, or chat with the suicide hotline at 988. I would love to be able to see you tomorrow. Informational packets and or forms will be in the following website. Don't forget, like, share, and subscribe.